MBCStaff.ca.
Good afternoon. I'm Fraser with MBC Radio News and Ronge. It's safe to say that the COVID-19 pandemic has gripped both Canada and Saskatchewan in the past week. Last Thursday, Saskatchewan had its first presumptive case of coronavirus. By the weekend, there were 6 cases, and as of this morning, there are 20 cases in the province. One of the cases in the Northern Saskatchewan community of South End. Last Friday, the provincial government announced a series of restrictions, and on Wednesday, a state of emergency was declared. Gyms, bingo halls, and other recreational facilities have been ordered to close. Children have been sent home from school, and gatherings of more than 50 people are not allowed, and many businesses are closed or operating at reduced capacity. The situation has caused a lot of upheaval in the province. Anxiety is high, and particularly in our Northern Saskatchewan communities, where there's a number of communities that are under stress with a lack of access to safe drinking water, health services, and adequate housing. Some things are known about COVID-19. It's a respiratory illness similar to the flu with symptoms such as coughing and high fever. Preventative measures include hand washing and social distancing, which is recommended. However, many things are not known. There's as of yet no vaccine. Cases seem to multiply rather rapidly, and the virus appears to affect some people more severely than others. And perhaps most importantly, how will we now manage as a society as virtually things have come to a standstill at the present moment and for an unknown period of time? So this is why we have put this show together for you today, and joining us are Simon Bird, Education Director for the Lac-La-Ronge Indian Band, and Josephine Greyeyes, Emergency Services Coordinator for the La-Ronge Band. And joining us also is Ziyed, who is the Medical Health Officer of Saskatchewan Health Authority's Northern Population Health Unit. Joining us also are MBC's Cree broadcaster, Abel Charles, and Dene broadcaster, Willy Billette, who will be providing translation. So thank you, everyone, for joining us today. And we know you're all busy in this busy time for a lot of people, including media, and we appreciate you taking the time to do this. So I guess I wanted to start with a question. With all the changes going on last week and that things have really been moving quite quickly. So how has that just been for for your office, I guess, for the office and the people and the staff that you work with? And maybe I'll just start with you on that question, Simon.
Well, things have definitely been taken very serious. As you know, our students, our parents, and all our communities are our top priority. And the worry that we have is the lack of information that may be going to our parents and our staff members. So we are focused on working very closely with Lac-La-Ronge Indian Band Health Department, because everything that we say is basically a representation of Lac-La-Ronge Indian Band as a whole. And so we are working very, very close together to make sure that up-to-date, accurate information is provided on LLRIB.com along with our communications team.
Okay, great. Thanks very much. And Josephine, you work in an area of sort of coordination of emergency services, so that can be rather broad, of course. So what are some of the things, calls that you've been getting last week, and what have you been trying to do?
At this time, we've activated our emergency response plan for Lac-La-Ronge Indian Band. We have been preparing for this for a couple months now, editing and updating plans, and specifically pandemic plan for Lac-La-Ronge Indian Band. We have so many flows of information, and so one of the biggest things for me in this situation is attending a lot of meetings, sharing that information with our communication coordinators, and organizing and participating in our emergency response team meetings. So we've been having those 3 times this week and a couple times last week, and coming up to it's getting more and more. The risk is increasing, and we are trying to mitigate those risks by encouraging proper hand sanitation and just encouraging personal responsibility for our band members.
Okay, great. And I guess I'll talk to you, Reem, or Dr. Ziyed, that I understand you've been in lots of meetings the past week or so, yes. I'm sure. And maybe you can just tell me some of the activities maybe that you've been in contact with northern communities and things that you've been doing.
So since we started, we were monitoring, of course, in the other neighboring provinces the situation, and we were expecting that it will hit us at certain point. So the first things, of course, we had the Saskatchewan Health Authority had an emergency preparedness plan, but at the level of the north, once we started like phase 0, we started to have more preparedness. We in the north, especially the area I'm covering, in the Northern Population Health Unit covering north, the KY area, and Mama Wheaton Churchill and Athabasca Health Authority. So we started a communication meeting with every staff from the health region, and we coordinated our effort in terms of what will happen in health settings, what would be in ambulatory care, and what will happen in our community stakeholders, and what will be the line of communication, internal and external communication, and what other expectations that we think. And we divided this at level 1, level 2, and level 3. So level 1 would be when we don't have cases, but we are anticipating, and level 2 when we start to have cases travel related, as we have the situation right now, and what we will do if level 3 things escalated and becoming when there is more like community transmission. Of course, we are allocating resources, so at every level. Now there are some resources, for example, the health inspectors are working in communicating stakeholders and making sure to spread the message about the preventive precaution and what we do. We try to communicate with our community stakeholders and spread the consistent message and address their concern, and make sure that all of them have they have an emergency plan in place. And we try also to see what kind of services that we can allocate or relocate towards the pandemic preparedness.
Okay, great. Thanks very much. Now I guess we'll move over to our language broadcasters, and I guess Abel, you'll go first with Cree Translation, please.
Dene Fraser, thank you very much. Tultiin maga kigo chutta homa kappi ja kanotsa ka pona pihtaa kissa ka ko minot tiatsa mustata kuida ja mihchitit togatset noga ja noats poku uani tihtamo ki vajuma. Tän somaga uisa paga miskagoak. So mihchit avuja ka ja ka kuitsi muina haja I gamtona ja kikitsina hot. So ja kun maga uja tuttama ko tähän nohtsoma ko tago ja nohtsoma ka pona pihtaa kissa ka kigo ja negi tuista muatin tämän sahetuitse koko tahkaapetse kiisko kaskihtajan muuda wassimi negi toan muuda minen nohtavittoki muuda ei tauikin kuisikin mähkoma tiivitaka ja takiski tihtamak tämän soma taki tuttamakkoma tämän soma taki suoskaujak ja kumu mutta ka ja ka mäms kuttamakkoma ja ka no tiatse mustata ka tämän se kiituitse koko ja ka kaski tihtakaagi vai maski no piekota ja nyt mä näen minua kohtaa ja Simon Bird kesken hommattuin ja kikittää me kohtaa la Ronge band mä ja itse kahpu minuuttaa tsemuinuista ja pokitastakin ja pattan loma ja kittää vasta uskaa ja mihtikin Cross Saskatchewan ja Josephine Greyeyes tähän ja kaumina ja kohti la Ronge band ja toskit ja iwitsa toskimaatani hän tähän ja oppadihtsikiwa mis kahkeda vittu kani hikki chane kopun padihchigi yok iwi tapmat imahmama opechek tan somatagi tuttamaki ko tan somatagi ta ko sit nok igwahi tu Josephine mudoma ya itsachuide ko ako masasuma kaya siis ni sopisemitta kaspenomigi matche mahmama opia ja me tuttamaki manista makoma tan somagawi tuttamak somodaida ja tunnissa Suomen satsuide kun näin että so tapitane maamo penetty sampo tahto kissaga vittu kun maamo ja kivi tapmatani he kuttaga ja hota suitse kun tan somatagi itatse mustawa ko band members tan somatagi takamikisia ki komatagi niikin nämä ka pihtnä mahka po ko siis soma so tapitama maamo ko joku tonni me maamis kuttaa ko ja Kusoma ja kitittego ina na mina maga last Thursday homa ja kutta kispa de ganio gisagak ikus pinstum gagi wihta kwaut te pahaska nigema. This is the province. Premier Scott Mo witha wa kiittu yok utta ganio gisagak piak paga kamuta tayawa no ikottua kiska kutuma COVID-19 o mutta kusuin kiame kusin gisdegatin. Ja tapos kutspiagi ja jawa kiittu jokos pi utta ganio gisagak. By the weekend ja kun takoutakamat näin kissakaa ja mihin kissakaa saas niin kun taaskin ja kissakaa koko maksuinkin tano na annoskaa kissakaa niistä noiko niistä no tapiskutsi kissakaa kun komi tuota suin piegoti opetto kun sonoki miskavau kihtsinatsi kissakaa kun tuo mutta suin kiivit no kotimaan mäga so aja kokin maa winnawa the province ja Täpittä uistaa sampo kun tahto kissakaan noukussa kun sakasti petitsega ne ja radio ja mitse kuuma ja uihta muatsekat sit nuo tän somakau ja tispadegi kun taas kutsa ja uihta maako inano ja ikut tohom jästää sihpä kakoma käämä mihtsit nanuik ja sitä muutakin itty joka on Monday 250 na muuta osamittakin mihtsit sekat sit nuo minä niin samtaa tumtani ja nomtano kun tahpukin iskottakin mihtsit nanuik itty joka on Monday saa samina mastauma niän nomtana joka pukittu joka kiisintä mihtsit nanuik niän nomtana puku kun tuo puhuttakin maailman joka sit nuo piakuiknan tauita so ja kun miestää sipä koko mittakään kahussaa miet nanuik taas kusminakin pahan moka ja miitta uikamiko gymnasiums ki pahan mok minä ja että hommaa saa piipä hikiä ka bingo moka miitta ui ja titkidano muutaminakin tauita mikä inä kun tämä mihtsitiä so minä nää toki ka casinos ja pähikatti wa inohti niikinä kun ei kausam tämä mihtsitiä kun mutta so tansma kun mutti että niikään ettukin muutam tunnekin sinä on aina otan se tekee suoskau ja Simon mini tuomaa ja niikään nähtää kun mutta ja mihtsiki joka tauita muuta teki tystä muoka ja Simon oma uistaa ja inni hilduit maga ja niikään nähtää nähdä unikin kun mä the parents mean ottaa ja mihtsiki joka students ja kun niikään kähtää kun viikaita kui että koska koma ja kun niikään näkee mä näen mihtsiki kun ingakin pahinan pitämään ja kun hommat tuli käymään kun pitämään muutakin sinä on aina ottakin tapahtukaa työmätään suomakau ja tispata kun maksuin kiispin chikihtoa mitä tohtii negatiivaa näin tauispiisku iskuta niipikin ja kannan muuta ja tuonnekin skiititsekää titsis kun tämän spika ei tohtii nähdä maakaan ja kun mutta hän on suomakau ja mituttamään kun mutta minä ja täpittäkin kyvyhtämään kuin inään no taka kui tohtamään kun kumminkin siihen mikä on ja kiikaa tässä siipihtämään taka kui kiispinchi kititega inana ko ista siipikin sihtseäkpä piähtä kiikäpä pääsi kitääkä mitti joapu kun siitä ottihtaan ino aja koustas tottamak ki pähihtäänkin tunnokin skuonno nän ikä ja tässä suikottiko mutta nän tavahpukis tunna so nänä tohumi suihtamaa kaujakin kun hän he taka kun ja metsää mahkomakin saa siihen kauja kiitu itse koko kutta so ja kun ne kauita mahko taas kun Dr. Reem Ziyed ja kun opiak Population Health Unit jo tatoskit maskiit no kauita mahko mennä Josephine Greyeyes kun pädihtsikin otia ja Ronge Indian band Simon Bird Education Director awas sahiya tuskavat jokes kana homagi wa mina the parents tuskawi manamaga joku sama kittukin pitämään niitä mahtaa ja kuitsema ja nui chatoskimagan Willy Billette ja katsomutuista.
Okay, merci Abel ku dunsene ke gadrel yana jan tani ha sani deli tani ha sani del hade der that's already banda ya elthi ha sani dela ku gani asthala ni la Saskatchewan gaya Thursday nastani last week nastani Thursday ay ku isha dainila jadizi Saskatchewan gaya ayrilu weekend ni dero ka anaskat hajala kultu du banda irin thu ju nonen nautan cases when la jata Saskatchewan gaya isha gozi south ensano last Friday halju dezin tonight day halju sidanil yala schools in as day they do then the asha in deal they had do al chasno day they no had do al chasna se day as me ask then by Bagano Tare, but Nidakolo, but Kulu Baja Bagazano, Thursana, Nakuino date in Hetzedila, the Asi Kathitu, Tilsana, Yanats holiday is granted data, Asi Hilaguzu, Tilsan, Hetzedi Center, Dada Vachonejera, Ayad, Duma Sani daily. Duma Sani daily, Nen Asigadarus, Yadarus, and Twasan, at the Dada area. Ayad and a son, then a son's in the Kulut Hanest, Edana. No hell, they are Tiazida. Don't Zenega, the Rad Dilosi, able the Anai, Lucy, Dana Asliasan. So, I know that he had it, don't Zenega. Simon Bird, the education's ungo their LLRIB Indian band had in a goal their lay. Josephine Greyeyes, the LLRIB Indian band had the Ellen now, the emergency services coordinator, Helena. Kuti, the health dada, Reem Ziyed, the medical health officer, Helena, Saskatchewan Health Authority, Northern Population Unit. Ayer Haalan Nasa, Ayan Sajani Delu, Asadai LQ, Nangadarus Yahandarohne Asi, and those a day, as long as the Ajada, Anohadestia, Nohalde Altiazi Bazi. Mercy.
Okay, thanks very much, Willy. Dr. Ziyed, I think I'll start with you next, and if you can tell our listeners as briefly as you can, why has the province taken these extreme measures of really closing a lot of things, declaring a state of emergency? Why is it necessary to do that?
So at this point, when we have increasing cases of COVID-19 virus, so the province took these measures of declaring emergency, so that we can try at this stage to contain the infection and prevent its spread in the community. So that will allow to sometimes when we trace contacts, we can may apply some strict measures that may mandate people to home isolate or prevent them from leaving or moving from a community to another. So these measures are important at this time, and we are always balancing between taking strict measures and the autonomy of the person and the personal freedom versus also the community well-being.
Okay, thanks very much for that. And I guess we'll move to Willy for translation.
Kukani, the medical health officer, do one cases can rate eja. Ja, dan land u dat zo. Kar oailialin het het dila. So da han terug tilde, da han coach gooit gaan o sanu thande, da han nelat in na debet o no sanu thande, coach lezen aan het het disa. Der do aanzi dat da nalt sa, dan die kan ook deze nani. Da han die ayane lin sunde kolo, da koen ook teen het het disa. Kudi terug til hade fondus ade maybe as een kado tosa. Ja, dat nalt sa. Ja, het bod dio, die bejonen Jason dat Henisa.
Well, ndoti magaya Dr. Reem Ziyed, ja ga kwitje mito maya. Tani ga te behaskanige ma the province, tani ga na ja kochi tasuito maya ka the suyu ina ho maya ta skocha ka ja ka wihtamago akta ja ga misi tani ga ni se ka kwitje mito wa go hi tuito maya. At sitno is pia kot muuta me tyydihtam pokiseta että hita soatihta ujak. Että punihtaa tomido igauti titohti tigaumista tuota muuta kanama ja usaami tyydihtam ujak mä kapukuttakin tää mähka kahkillau at sitnoak. Uidi asui pätäko mutta ja kahsuin. Ja so ja kanam pukuttakin tää pahtama kiitti toomaski kiitno utta uhtset tappuko koke mauin. Taga kuiko soa tätä no taga kuiko soitoma taga kuinniike pätäko mota taga kuinniike nämä kiispiniga egosta tuutsegaattiga että afuittu ikite pannavasta soipat no mutta so pokotetta ja takkuuta soa tehty kun nämä katset no kohan ja pakus siitä maagmista hikisin tagiga kuin tohtako tämän somagitaan noitek i tuitamski hit no Fraser.
Okay, thanks very much, Abel. So I'm going to talk to or ask Josephine the next question. It's a little off script here, if you don't mind. But I think what a lot of people are thinking now is they know the agencies have a lot of demands but people want to help. They know that the seniors, of course, or elders are the most vulnerable. People with health difficulties, people that maybe can't get out of their house. So what would you like to get the message out of someone that wants to help? How can they help your organization make things easier on you to do the type of tasks you're trying to do?
At this time, we actually, Simon, in our meeting this morning, has taken over volunteer coordination. So Simon Bird will share his contact information, but he's doing volunteer coordination. At this time, we're utilizing our staff as we are limited in service provision. We are utilizing our staff to fill some of those gaps. And we had sent out communication door to door, a communique on behalf of Lac La Ronge Indian Band and the Emergency Control Group. And so we are just really trying to utilize our staff that we have already and keep people, trying to keep people within their own spaces and their own homes, and for us to provide the service as much as we can at the moment. There will come a time when we're going to have to access those volunteer lists and bring those people in to do different things, but at the moment we're trying to utilize our staff, and Simon in the meantime will be compiling lists of volunteers from the community. I realize that everybody wants to do a job and everybody wants to help, and that's admirable. We want to limit contact. We're encouraging social distancing. We, as health staff and band staff, with our limited service provision, again, we have that capacity to be able to help in different areas and to reallocate human resources.
That's right. I can understand that you want people to help, but it's got to be in a productive way that doesn't do more harm than
exactly
good. So thanks very much for that. And yeah, I guess we'll move to Abel, for translation.
Well, tuuti magayaka Fraser ay kuitsimata ya Josephine ay tansi tutami gidawa widaya mistahatuski winoma muta titaya tatuskachagati go muta. Pakusida got sit no that kagui chihichik. Gwahi tuito my Josephine anaganta hatuski daga naganaganta katoskawachik mi gots Lac La Ronge Indian Band iagunik ayak ni mamisito tawana nak pakusida mana nak tawi chihigoa homa. Pitamai iagunik. Widaya ka apuito kachapachama sismi nanga nga kuichihimunan hawiak chitagi wichihi moda chishwi ko tantaya nan moda chishwi ko sintotinan magan nigan o got ya ka tuska goa ko ya kunega nigan nga kuichimana nak tawichihi goa ko ya ko maya ahpo ya piyagi ko gi tochaga tigidgok idgok gi notti aya skidihta moha ko aya katsetno band members so squatso ya ki pa mi tohtio tahtua squahigan tahtuaskahikan taas ko chachimuini tohta tekotti so ma kummi kwachuma ya kitahoma kaya mi kwach aya atoskida kanak band staff ka toskago akwa ya kunnik pittama aya teta toskatta magoma teta wichihi go akwa aya ka igwa ya Simon Bird ya ni gana thau teta ya Udepadihta toskiwin togi gometagi tochagati gawin tagi totaki agwana to the padihta ya widonama Simon Birdie tuitawaya Josephine.
Okay, kukani Fraser yaharn Kirsan Josephine Greyeyes lantu edalo na kujo Josephine and dogala na kanino hakuri sinda Dene Emergency Services Coordinator Helena Lac La Ronge Indian Band Kudlant u agadalo na ayes ni San Fraser lantu andu der that's the Heleni Kulu dene that haili had an senia sieni there volunteers are asked known as don't ayesan golder hade dene do Simon Birdie yetsan golder hani la dene that hid dene that haali ala do not tsarani hani kuti yer dai no and dene no padala na danli no tsarani hani Kuti Harilium band members standi Sikadurel Yadurel in the Erklis Gozin dana Tarali as a Quentin Kuti Atlardala Nade Elchazit ino te yazi da Anze Elkano te sanan headed dear a Jaculi de Hiltia a Jachazi de Hiltian Sanja a just studios dotsi day out here a I can't do a galan nahase Hennis and Josephine Greyeyes I do.
Okay, thank you. So the next question I have is for Simon, and I know the decision to close the schools must have been a difficult one. It probably appears in light of it that was the right, not close the schools, but I guess to the students anyway, the right decision. I guess that was effective today, correct? March 20th, yes?
Actually, Fraser, first of all, for those people that want to volunteer, you can check for an update. We will be updating on LLRIB.com. As myself being the volunteer coordinator, and as Josephine mentioned, we're not expecting people to come in off the hop. It's gonna be done in phases, right? And there's a lot of our mining companies, for an example, have contacted us as an emergency response planning group in terms of providing extra supplies, especially hand sanitizing and cleaning equipment. So we're going to make sure that we are working with amongst our staff, and that there's going to be a call out being put for specific roles. We make sure that anybody that wants to volunteer, first and foremost, practice good hand washing practices. If you've been out of the country within 14 days, we don't want you to volunteer. If you've been traveling out of the province, we cannot afford to have you volunteer. We're looking for healthy people with healthy hand washing routines and not touching their face. We don't want any cross contamination with whatever we do for our elders or our community members. Next, it was not a hard decision to close our schools. In fact, we had already started preparing on Sunday with a round of phone calls with the Ministry of Education and our fellow provincial school board, the Northern Light School Board, as many of our First Nations already did, is working with their provincial schools. And when the time came, we actually were starting to already have principals meetings and staff meetings. And on Wednesday, when the state of emergency was actually announced by the province, we already had practically no students in our school. 90 to 95% of our students were already staying away from the schools in terms of public gatherings. And so with that being said, we basically made that our last day. So as of today, all of our schools, Lac La Ronge, Indian Band, have closed.
Okay, thanks very much for that. And I guess we'll move to Willy for translation, please.
Kui gani Simon Bird, diri nanduala na hade Lac La Ronge and ban had to get school not there, it's angol there la. Kui gani horal kursa, hor now some school there in Tia Yesnisa. Ku Simon Bird adu her nail henny. Galtana her you see it's at house right Johnny Ani. There was a Saskatchewan state of emergency unlock any Wednesday. You're cool, you're quit at Dene school there in Leo. It's a quid Dene Altana any. Altana it's a quid about 95% and it's a quid school not did jog Altana. Laku Billette, you know, Banchu, but Hasi in La Days, when the school not did job. Yeah, is also the Yearland in the school there it Henny. Could the year you know, the where out of the country now there. Nanzan real English a henny. A year day in loot, the seats and a hen yada, Alberta, Saskatchewan, the Quebec to hook and I yada in real English a henny. And then I had head now what he belag and all silu that Tlaconte, a conti volunteers real is henny. Could he mine in Henila, the Canea, the Nahalian Tionedy, there is supplies downly, there, the Nalal Tladanly, and that Tladanly, Conti a seer, a Notarani, Hanisa, Simon Bird ado.
Well, tutti magaya Fraser ai kuitsamata yak Simona ai ispigagi tassuanu iktaki pahigati kiskino hamattu igamego ai kigo heitu Simona mudana mochana ihtauni ganema Nigiwitap mana nagokutta kuttagaga patihtaatsa kiskino hamattu igamego taas kutsawa ya kihtsunia igamassoti region the Minister of Education nigiwitap mana nagminogokutta yak Northern Light School Division kapan patihtaatsa kiskino hamattu igamego hotigiwitnok ja magani hanta higa picture kaya kiskunega so ya kunega menengi witap mana ngi principles ngi wa witap mana ngi mama opinan I wa mina moi tuja kuumattakin pähämäksi klohomaattuja mä saa mihtit muutoksia pie mihti joka vassak tuna ja saa sekin että siiga uja kuuma tui uniigi hiko mauki näet kun saa semmoista sohiga että pihti so muuta mä nohtsana ihta on takin pähämä kuuma nohtsumaga kissaga kun näin ja kihtsuumi kun pähikätti vähän nohtsumaga saa muutoksia mä mihti tuoga ja vassak missä vaatmiina ja kohan ja kanan tan staminegi tuitan mä sai mun nämä ja uitsi hiujok kiispinaoi nohti uitsi hiui mä nämä ja että millaisen että tihta kun joko katset noga kis näntä nohti uitsi hiujok mä kiispina oi kiip motiho wow uitsi kiispina oi ja Kiina katam Canada ja muutos samta vidama joka anta piuitsi hiuit vidiga ekski tihta kun kiispenchi mitä so ja mä ja puittukat niikan mä nämä kotiin joka tätä vidihtaa kun suoga ja kuitsi hiui joki kohan ja kihta konne mitä teki syypä hikitsi mä nämä ja Simon ja you said.com is that .com agachi .ca
.com
okay so summa nämäkin kun tähän nämä ja LLRIB.com ja teki syypä hikiminen kun tähän nämä semmoinen minä mistä he ja käymään mä opitsi koko kiispinuskaatse muina ja tämässä nähdään kun tätä miskä niin Fraser.
Okay, thanks very much, and I'll just move back to you quickly again, Simon, if you don't mind. I guess what the fear for people, obviously, or the unknown is when, obviously, students are out of school for an unknown period of time, what happens with curriculum, what happens with the next year of studies, things like that. So maybe you could just outline for me, do parents have anything to worry about, first, about children losing their year, what will happen maybe with students that are wanting to go on to university in grade 12? And I guess the third one, I know I'm asking a lot of questions here, but what are you working with teachers to perhaps provide lesson plans or work with families to provide some sort of education?
Dene Fraser, I just want to say that the mental health and the well-being of our staff and students is top priority. We are basically taking a week break to take a pause, to understand and to educate ourselves as staff members and to realize that we need to make sure we have our houses in order. Our children are in our homes, self-isolating, and I encourage that our staff members and our parents and our students take that very seriously. That's your number one job. You know, the curriculum is now on the back burner. As of this week, we are making sure that the skills and the procedures are basically making sure that we educate all our students how serious it is. And so we're starting to develop a plan with our principals this week, and early next week we're going to be doing a round of conference calls every day with all our principals and our administrators, and to formulate a plan of how our teachers can be repurposed in their roles, and to reach out to our schools that had all their students and to their parents, and just to take a small inventory. You know, do they have access to a phone? Do they have access to the internet? And how are they doing? That's number one rule, and that's our top priority. And in regards to our high school, we are starting to shift our thinking of how to deliver high school programming, either online or shrinking the number of students that we have in our schools. And so making sure that social distancing is top priority. I understand that at any one given time we can have a facility as long as there's a very limited number of students or staff. And so that's so after next week we'll start to formulate a plan. And for the next 2 weeks, there's going to be some generic lessons out there, just reading and activity enrichment packages, and not homework. Homework is not a priority at the moment, but having kids being engaged in education and communicating and contacting and connecting with our students is top of mind right now.
Very good point, Simon. I think everybody needs to sort of take a deep breath. It's been a busy week, and I guess I'll take my deep breath this weekend, but the students, we're going to have their March break now anyway, and you know, with family that they can spend time with, it's important that people just take a bit of a break. I think you're right, for their own mental health. And I guess I'll move to I think Abel now for first translation.
Well, thank you, Fraser. I go Fraser, which match Simon. kibam tonidihtina wachi kibam skutina wow aya kigoma nagakskinoha mahtawas antawa michigit aya minogotta aya mtaat nissab kotna amigos te sabuskamakchi yaguido anega maganta kawi tohtichik university ki spagiskinoha mattu intan siagonih kigwaya kibam skutina wachi sikaguchimata Fraser Simon akamaga Simon itu miigats muudi jagunih tunniga nastanan. No ots pogo taskana kina back burner tu miigats nastanan jagunih hanne muudi jagunih nigan. Pitta mamahti kitab misotan. Iswahui cha mittu akoma. Kitab misotan. Kimido ajanansi mido nochi kitayano. Nigan jagunih nigan nastatan. Muuta ida pitta ma muutti kiiga kavi pattahamah kavi patnamah muuta pitta ma jaganema. Taapuidat nigan oti. Miigats nuahui tap mananak aya principles ko siso kuskina hamagi yok tan so mutiat nigan tagi suichi ha ko wasak tagin tabi negi chuga po nansi ga kuskina hamagi yok ihta kon dochia yamagan taho ka wi chuga wasak ga chimina po mahtawa ba chisgan internet ha puito yagon itegeta patana ni otiat nigan aya I twitter maga mo dami ko chi yagon bat tatuskati nanuida yagon hanne ha puito gimina piegi ko isin stota got ni da ya Simon puittogi ogutta huawistio ogutta ja kispa de kiskno hama tuiga mek the high school students puittogi tegi pihtogi jog magi gat ma michitsik gat ma michitsik ja puittogi tegi puittogi ja kana minimum tuli rihta ma kana ma ja I twitter wa ja so ja staff students ja kana ma ja ingetap mana na goma wa ja taas kotsmina mahtaa chichigan ja puitto kotiet nigan tegi kskino hamoa go gotaka patta wa ustina ganta ja high school ga michigi chigi dia gonna gana mana maga ja pito se kskino hamoa go ja kakito ja gonna hinta tuskatinan maga nigan otti chapa chama sistita ja gonna matatti ki kana gon tansiga wisi waskawi tottama pittama kitab misotan kidan tepido tahoma gaya mi guachoma ya kunigan pittama I Twitter Simon
kui kani sa Fraser Simon huril kursa der nahit sa kui don grade 12 dal CSE nahit dana university tse dela drill inu thosa I Belgian royal tia ni sa well ku Simon Birda do don isazara tharen ha school diet khanza nan desident u Royal Alcigar is doing a drill, you had the Royal Tiasenium. Kulus and staff and Hadalan Nasi, the Harno, that's already Nizwant Ilona, Sequiti, doing Atana Chileland, is Icador Yalant, Ilasan, but Ascuna deal, Nisam. Who eat Hodunil Tanho, Iron in the Tascula dealer. Their that's already Nizwantila, a conference called down the Ashaw principal health Henila that we another de la sea Henisa. Could it that curriculum cannot the Dene see your current day is a good abed the Henny back burner Henila. So conference call or you see internet downly it's a key Honel Tanrish in the internet it's see information the bits is 2 weeks reading the Asika here is the Kuhela Donald Hanula Henisa Kuluza Ashkaza no Tezana who Tiena Lad Ignorable Silo can't with us Zangashan Bonotil Nalis and that's already Henisa.
Thanks very much. And I think I'll stick on the topic of mental health for the moment. It's I think we've been all talking about the medical issues, but it's going to be a very big issue for a lot of people. People aren't at work. People are at home. They're under a lot of stress, and we already know many of our northern communities have mental health challenges of their own. There's high rates of suicide, high rates of youth suicide. I don't need to go into all the details. Everybody knows them, but. So Dr. Ziyed, I guess a lot of the communities are already struggling to meet some of these challenges already. So with the changes, I know that First Nations are under federal jurisdiction, but we do have cross-sharing of services, and obviously healthcare is a provincial responsibility. So is the province going to be helping some of these communities that may be remote, that may have these challenges, that to set up so if someone does have a mental health issue, that they can get the care that they need?
Certainly, this is something that we take in consideration from the beginning of the preparedness. First, we work with our colleagues and counterparts in Northern Intertribal Health Authority and in First Nation and Inuit Health Branch. The other thing also, of course, in our community here in the North, we understand that we need it at this time to understand our strengths and weaknesses. So as the more that we work on understanding the gaps and working on the weaknesses and be transparent and collaborate with each other, the better we can pass through this crisis. We identified many issues that could affect the community, the northern community. For example, the overcrowding in case of if we need to have home isolation. We understand the anxiety, even the restriction on movement and all this with communities with low resources and no recreation. So that also will create some burden. There are some, of course, cancellation of non-elective services, but we are really trying to manage as much as we can. It's not only like taking the community service as part of the pandemic preparedness. So we are not really canceling services that are related to community as much as like we try to have this balance between social distancing and providing the service. As for mental health, this is an important part. We strengthen many areas for mental health providers in areas that were in need, and that's before the pandemic started. And we try to have really a plan of collaboration. I know that there is shortage in mental health services in many areas, so in this time we try to integrate and operate together. There is at the provincial emergency preparedness plan, there is 16 annexes. One of the annex is related to First Nation and Métis, and another annex is related to psychosocial complication and consequences that we need to consider. On the other hand, there is other work group across the country for vulnerable population and vulnerable communities. So we exchange knowledge and we try to come with innovative solutions that can help us here and in other places.
Okay, thanks very much. And I guess we'll move to Willy for translation.
Well, kui kani dan dilut ada dini lolia Reem Ziyed adila medical health officer just Saskatchewan Greyeyes ku ya yurin kursan Fraser yurin kursan the mental health in ila dene thi dene zuo and dene thina the konti bazi the royalty nisa so dinadu dan the royalty hada harlun ta dena no hela dalan now Erdaino Nithatio, Harlima Sadalite, the royalty, Tigradrill, and a year day, Stiadalite, the Halenilla, down then a not Serland Ilo, down then the Cara Uland Esse, a Diotib Boroil Nihalahene. A collaboration Henila, a Yas Nisanhando, a Sagadalite, that is could the Nunigadrill, Yana is yet thin as a night there. Ishak when they charge other Nestu, Taj other Nestu. Connected than not deal than a not a data. The Boris Niland is a down league on the day Ticolansa. Do a shot it's a Dilland Ilahani. The table oil needers or seasons are still a roof in the any. Could they dying load the social distance on by a tila, that's really on la. So then a gun of Tisana. Then a bagan of Tarab is need the whole by Bagaz and Deals and Nisam. Could they have mental health? Unland Ani Harlua satellite that it does answer any their First Nation so no is it don't something time by Yastana Harlua satellite that there the question about Hill Nalosa Henisa.
Well, in Tortimaga Piegi got it Shenigi, Tonomaya Key started about 15 hours. Tansigin Stortina wow. Model the same donation noch in Stortin Giamat der Simuan. Social distancing gone me one of my kitchenats. Ya Kappa Machimuan Manoma Kappa Motihoan Kappa Kaya Miha got at Nok. More than Tastagata, that would one of Sampo Samiska was Tonic Swag and take a Kuchamagagi way without Gachamago. annotsa kohoma kiissihke megawiyaki kada mtunni kissuaga ja taas kutsmana mityytihtä makatihtaa koska ntotsek tawachi mitotsek ko siisoma ja kwanne mi kohoma ka na watchpo koma ja ka tahamaagawiyaki ka mtun taas kutsu mutta kapiak nit nanoma ja tunna ja wahta isoma nanto nian mistop minua huita mittunal muudam tunni kissuag nuita mittunano mutta so ja kwanne mitto kanne ma ja ka social distancing ko mi tweet min Dr. Ziyed ja moia po mutta mistä hada mochagati ko mutta ja kaksuin COVID-19 moia po sa soma ja katset nok ikiga wiwichi ha ko kiwit nokoti a tihtat nok mistä kiwa mamtuni dihtamok pigui dihtamok kaski dihtamok puituik siwi dihtamok ja na toho magi ko ka no chihiko ki mamtuni dihchagannak mental health ja puittu kaatiht minä ja pigui dihtamauiak puittu kuskaa ja muutama kuskaa ja minä poko puittukin tihtmään nuokun anteeka kui tuottaa sotsiga ja suja kun ihan niihin kiikoja pokutakin tää pähtämään awassi miittokaa puomini kun tuokin koomat että nuokan nooma ui tomikin tähän mä kauja kun muutakakin tai mittava anotti muutakakin kioko kaki mähmihtsiit naagi vitsi aika nuokasti ikin tähän mä kauja puittukaa awassi tämä toni tihtä mihin koko minä kuin toinen katse no se otakin tää pähtämään pokiako minä Taki tapahtuma po papiahtako mutta ekohan ja we have to collaborate to give adogita ko heko ta we chat to scheme to apoko ta ja mi hitu ta skost nit nanoma Saskatchewan Health no ta ja mi hana nak we chat to scheme ana nitha the Northern Intertribal Health Authority ni hido ya konega ka we chi ha so modai da ya papiski ngagu to skana ngagu ya mi hitu nan tan so mutagi so we chi hitu pia kona chimo inta we ato chagatik ja kanne minä nämä communication ja kappo jak tähätse mut awi nana gawi atse mut tan sana gawi tuit ja kanne minä kitaba chagatik po so kattawa komitis atse mun anno ti sato chagatik ko iga massana pappi toski ko että tihtaa ko so ja kun joha ja tatuskatina anne kitaba ni tuittava ja Dr. Ziyed.
All right, so we're getting close to the top of the hour here, but probably time for one more question and English answer. I'm going to take a break at about 2 minutes to 2 for commercials. So this one is for Josephine, and I guess with so much happening again in the past week, and people we're not really aware of what they've heard, seen. Of course, English isn't the first language in many of the communities we serve, as you know. Have you been able to, and we know that not everybody has access to internet or maybe even a telephone, right? So I'm just wondering if for some of these vulnerable populations, including of course seniors, in the past, since we sort of went into this sort of in the last week or so, and particularly in the last few days, have you been able to reach out to make sure that everybody is okay in our communities or in your community, sorry, and how they're doing, and to make some sort of contact?
We did a door-to-door distribution of information in all of our Lac La Ronge Indian Band communities. And when I speak of Lac La Ronge Indian Band, I'm including all of the communities that are associated with Lac La Ronge Indian Band. So in all of the communities, we had volunteers go out, and it was door-to-door distribution. Here in La Ronge, they did we did a little census or survey for gathering of information regarding identification of chronic people with chronic conditions, and so there was a little more interaction there versus the door-to-door. There, of course, were questions for the people who were dropping off and distributing these communications. With our volunteer services now going, we do have a number of things on the table that we need to identify within our communities. There are obviously, like you said, gaps of people who, and that was the purpose of the door-to-door, is that we have gaps. We have people who, are not all home care clients are, not all people who have chronic conditions are home care clients. So we had that gap, and not all people have students from the school. And, we had to identify that where we needed a communication band-wide in our initial communication to go out. We do have the Lac La Ronge Indian Band website, and then as well as the Health Services website, which are displaying the same information. Officially as of today, Kevin Roberts is our communications coordinator. He has a wide audience. He's a very skilled writer, and I'm really excited that he's taken on that task of communication, because I think with his familiarity with the community, he is able to better disperse that information, and with the wider audience that he does have. So we're appreciative of that.
All right, well, thanks very much for that. And we're coming up a couple of minutes before 2, so we're going to pause for a commercial break and news. Thanks.
The Northern Intertribal Health Authority wants you to know that symptoms of coronavirus COVID-19 include cough, fever, and difficulty in breathing. The virus can spread from one person to another. The best way to protect yourself is to wash your hands often with soap and water for at least 20 seconds. Avoid touching your eyes, nose, or mouth, especially with unwashed hands. Avoid close contact with people who are sick. Cough and sneeze into your sleeve and not your hands. And stay home if you're sick to avoid spreading illness to others.
All right, I'm Fraser Needham with MBC Radio News in La Ronge, and we're back with our panel discussion on COVID-19 and how it has affected everything, of course, in the last week. We have with us Simon Bird, the Director of Education for the Lac La Ronge Indian Band, Josephine Greyeyes, who is Director of Emergency Services for the La Ronge Band, and Dr. Reem Ziyed, who is the Chief, or the Medical Officer, I guess, for the Northern Population Health Unit here in La Ronge, which is part of the now Saskatchewan Health Authority. So I guess we pick up with we had Josephine answering a question about how I guess the communities are they able to La Ronge Band reach out to the various seniors and people with health challenges that may be living alone or not have a phone in the communities, and she gave us an answer on that. And I guess we will move to Willy for the translation on that answer.
Merci, Fraser. Ku kani ya breaks into Fraser. Josephine Greyeyes who in Kersam. They're Josephine Greyeyes and Wala Nahared in the Emergency Service Coordinator Hilonla Lac La Ronge Indian Band. Ku Fraser in Kersam. Tlant u dana horosh ni I yeshni. Na he dana phones the dabits inu. Na he daino the internet the dabits inu. Na he the classification the dabits inu san. Dana banatu telu sang was it around AC. Yes, ni sang ku Josephine do ahni dana he did. Dana Lac La Ronge by astide ni har junsan membership not DCE by asthisene John La Ronge yinlu Stanley Mission isan gozin har members Stanley C a thindaduilt usen ni sang darant AC darant AC ti no hal sorant ida that disana here kuluna heat in otorel kerheni who home care the died ilu home care the hoteborit in choilu heni kuluza website in its own health services website in heni kui launch la kwaza Lac La Ronge Indian Band Holland Kevin Roberts Dene communication bazi benannt is only the see that list the goal down at least the goal down at least health no see membership set is hanadan do dana agat ya badala nasi code this Josephine Greyeyes
Merci choa Willy ayakawayak Fraser kuchimata yak Josephine dan sigaya kisi at mustawaigo ayamihaigo and got sit no kapamihaigo. Ego he Twitter wa Josephine ya yagoma chimu ino mayak. Igiba pam pagit negatik so no waska higa na ho awiyaka kiba pamutio ki pagit na ho mi do chimu. Ego mina ya ngiski de manana guida manama ga neganta ya clinical ngiski de manana ga negama ga pamiha ko tabito the home care clients. Ego ngi de ngiski de tago so magamina apuitu mo da kakidam to ngiski de manana ko ma awiyak tagi wichit. So yagona mana ne mama obsidanta skuchi ai tapia ko mi kuichi mo kawi no mi to po tagi wichihak. Igaw yaginoti ashuya ma igaw yaginoti wonigis to tawak. Kagwi. So yuksana mi tota ko mayak mama obso gitogi go hayak ai tapo gina community santa ya kawi no mi te po kawi magochas nan tatagi suichiha kia guanami kawi igai nohti ko nigis totawa kawi yagi tuito me gomina ya nigi na suna nan minaga chia puigi mintas ga poito Kevin Roberts ya gana ya inuhta achmut minami chi tawiya wa pahtamillo masana higi winahpo ya gana achmu inte tapampadihta ya gana achmu ino ma ya kama mo pia ko maki ko achmu ino matagi pagit niga tigi ya gana tapampadihta ya guido achmu ni ga masana ga ya ta hachmut magi ya guina wasoni tanama tapampadihta ta achmu so ya mo dawiyak ngagi wanigis totawanan ya ngagi ay tapinan mam tunilihtinan gagui chihimunan ay so mo mayak antamina yak la Ronge band website LLRIB.com ko tamin tapit masna higiwin ay kachamuin pagitninan mangskidihtinan min mudra kedoy mamata ba chichigan ga ya ta puatit muta yamuin ay magana haya so yagun minan ke mudan nokti wonigiskis tawana guistawata kuigachitna kwa chamuin Kiamchi uta magan no aga china moch kiamchi internet computer ya aga china moch yegonik min nohti ach mustana nang takui pihta ko ma chemuin I Twitter wa yak Josephine so Fraser.
Thanks very much, Abel. So I guess we'll move to Dr. Ziyed next, and I guess moving back to some of the challenges some of the northern communities have in terms of housing and many people living to one dwelling, access to different things. So I think one of the fears that we're hearing now, of course, is that living in isolated areas and also, close housing conditions, so that maybe not the opportunity to self-isolate if somebody believes they may have the infection or tests, and then who will help them, because, many of the northern communities just, they may not have the capacity to handle something like that. So is the province sort of maybe putting a plan in place to assist some of these communities, even like South End, let's say if there was, more of an outbreak than there is now?
This is an important question, of course, and it's taken in consideration. This is one of the most important factors. Like, there is no black and white. There are many factors in an issue, especially in the northern population, where there are many social determinants of health are affecting the community. So, of course, we are taking in the scenario of if one person is affected, and is one of the most important things is in our management right now and preparedness. If someone is affected, and we need to early detect and do the early contact tracing. The most important thing is to know all the circumstances that a person is living in, and of course, if there is no potential or a probability that this person cannot be home isolated in a secure way that does not endanger other people living with him in the house. So we will manage to, of course, have this home isolation or this self-isolation outside their home dwelling, and there is home care as well. And we are mobilizing all our capacity right now to contain the infection, and we understand the anxiety in the northern communities, and we are collaborating together, all the services. That's why we are in a continuous discussion and have collaboration with the town councils in all the communities and all the stakeholders. So we have an inventory of a stakeholder list, so that we are in continuous conversation and messaging to them, so that they, if there is any gaps or weakness, we work through this weakness together.
Oh, thanks very much for that. Next we'll move to Abel for translation.
Well, kusawit with Dr. Ziyed, kagwitch mata Fraser. Kispinawiyak kagwitch mau kigik pogatayain takuskwachiyain pitama. So gisne ko sisik kwitch mauyak Aya kikusawi tu Dr. Ziyed. Ngita pati na niya kanama. Aya ka puitugi mihchi toskinano pia kwaskahigan. Takita patama pogo muutachi magawi kuttakahuja takia suuskamo minä otta. So ispinna ja kanimi kita patama kanen papia takanama. Äättä. Aya ka iga takui suuskamaattunan wikispinna ja po oppmigi otsitta kuttihunan tauti ko haja mahti pittämä kuskaatsia ja ota. Mäki kohmenakis miksi to okko tehtaan sama teki totsaga tigi ja kannemanga ku jätuskaatina niitui. Ni komina ja kiemi hän komina po ja kunigan yok town councils ja band councils and temi hän ainakin minne kun kanneki ko haja kika kui hatsamustava ko minu maui ja ko magi spinna ja moodi de maui ja puittuki kikiskaa komido ta poko tan taapinigi ja minä poko awido makagi wichimit somat awido kagi witaskinoomat nan tawita ja kanama ja tan taapiniga tipu ja kanama so ngiski tihtina ja kiwit nohoti awistioma ja pekotsa eka tihtohitsawin sa hajawa mihchitki goma makotiu kiispin siitä mitä että setno agatsi minä kiisin te tahkot setno saa soma kajahti mihchitki ko eko tahpampato ka mihchitaskenitsek ja ka ahpua ja että setno ja kanemme kun taminotsa ja kanema ja ahpuittuki muttakin mitä ja so mihchitki ko makotiu ma kiispin siitä mitä ja että setno kiispin minä ahpuittuki te tahkotsanano ahpuiga ka toskitsaka tihtokota ja puittukin noitsvokittamaan suokaa tehty kun sadmissiki koomikin tapahtama homma ja so ja kun ihan ihminenkin kwaja tunomista hiski kooma ja kuikin tapahtama toma ja kui chehitsakat setnogi että kui se suipalta kooma kui niikin palta kooma kun soi niin tyttävä Dr. Ziyed.
Okay, tukani Fraser you're Kursan there it's a quite Agalan Saskatchewan Health Authority Reem Ziyed go Fraser you're in Kursa there the Ziyed Tinan that's a day there that's area go it gozi ya Tinan is right do kilosinul sage ya hollade dana sanad dela dana sanad dela nake honen now nake saja dalu nake thaja dalu konali dana sanad dela who is sant haboring there glant u than another olia a year bequan doanzi dana sanad dede yes nisa couldn't u glant u dana harlun dana boring tia san you're not de had glant u there than konali dana not de heldan du asha dinil kiolia there dana ya home care di hun lieni la gozinil tinda than another de erdiasun yask adut hosan heni doanzi dana sanat dea ya dinil tinda zosa kuti dana helda ya tiholan zezia tinda zana de heni dana zezia tinda zana de belde ya tiholan zene chief and council di belde ya tu irda yino town of Ronge downly council mayor council downly di belde ya tisa dan tu da hansan taboring there de darali hasi henisa.
Thanks very much, Willy. So I guess we'll move to Simon now, and there was a couple of points on education that you wanted to bring up.
Thank you, Fraser. First of all, I just want to remind folks that we are in constant communication with our staff members. Taking a week pause does mean that to take care of their mental health, but we're also formulating a plan and connecting with all our staff, taking an inventory of who has any kind of counseling training. A majority of our staff have assist training because, as you may know, Ronge declared a state where there was a suicide crisis. So one of the things that all our schools, and I'm sure a number of our First Nations out there and Aboriginal communities have these staff members. And what the word that we're tossing around and that's been used by our emergency response plan is repurposing our staff. What we have is a lot of people, and the less we depend, and we don't want to flood the healthcare system with phone calls, people asking questions. So let's utilize, as educators, I'm challenging our schools to repurpose their staff, for those staff members to reach out to our family members if you have a basic script, making sure that everybody's okay, if they have any questions, and especially our Cree speakers and our Dene speakers, to allow that communication to flow a little bit more effectively. That's, I know, something that we're doing. And also, just to add, our daycares are closed, but for the community of Ronge, we are only opening the daycares for essential services staff members only. So if you're a nurse and if you still need childcare, we will provide that, and we still follow the policy where the children still have to not be sick. But we need to support our essential services staff members as much as we can, and a big thank you to them for continuing to work while everybody is being told to stay at home.
Thanks very much. And move to Abel for translation.
Kiigualuan tansanekkisik tagisuichi hiwisik taapuidamana magayakskinohamagi yogomatahtugissagamana kapahka dohtinigatigskinohamaatuigamikskinohamagi yogmassanaheganaagi taassuinanaa togiwa magahpuittugimina piitoski piisikiskinohamuaga puittugigi kiskinohamuaag tiisi ajamihatsiga ja taimitsigiwa ja mihtsitogota ja mihtsitkiskinohamuaag okiskinohamagi ta saab maatsiga ja kun taimitsigiwa tansigisaiamit tansigisimamtunidihtamit tagagui kahtset naatsik tagagui ja piskaap maatsikittugi tagagui kahtset naatsik kun antamanagatsiitsitissasta huavaasisuskaaja antoinohti tuutaasut so ja kui luonne maaki piikiskinohamuaag okiskinohamagi tansitiisi tunna kun ajakotti uidaya niistä apuiksi ingi piikiskinohamaga niin kannema ja tässä kutsama uskaa johonkaan piikuidihtä piitsosisi saimu piitsosisi vaskaviu näin tiidihtä huoma tämä kutsiga vahtoi täpet so ja kun hän kun seminisekskinohamagi joktaan näkemägiga joku sekisuitsi hiuitsaka puittukittagia ja metsek to the parents tämän sekitsa asemas mitä ajatsi, mitä nohtia ja mitä ylihtämisiä. Kun siis nanto, tii suitsihivistik, ikä näistä, että tämä siitottamakti the health staff okuti ja että klinik ajatsi, ikä jakoneka puittukimina, kun sanohamagi, joka näitä pähpiitostakin suitsihiujok. Omisi pähmitsiipinä mä jamuin, repurposing our staff, että se on enemmän. No puittukin muuta ikskinohamagi on massa nähkänä puittukin mä kohta piitos vintakin suitsi hiuja nikipi joku toinen mikä pikskinohamatsaka ja skinohamagi vinnämä tiisa toskavatsaka ja kawassa so ja kun se kiityi Simon kiskinohamatsaka Willy.
Okay, merci Abel ku kani Fraser Simon Ronge kursam There bits staff ya badala nasi tlantu gadala nali tlantu badaduril ali henni sa tlantu badaduril ali henni ku tlantu badaduril ahadeni inventory henni sa then asita dabits in si skills dabits in si their counseling ha e konti then kananit ha nutsenni ha Who can hear the Anstaland ile Jolaranch da yinu but do kelosina de to quit Italian day agenda it was a crisis a henni there a staff members who don't kanet and padala nasi the Dene staff kultu denazara niasa dantu denazay dole Dene membership aras no sanja can't gadala nagasa could they care the dying tanila Arlutan de kidain yanila kulu jalaranji leni da han han nurse linde best kana hun linde while best kana sitting in leho ala so it's a quida yele de ay dolya daycare ay it's a quinili hasunt ilesem repurposing the ayantida bitsi staffa ay can't agadalai dada estionoder losa hennis Simon adu.
Thanks very much, Willy. I guess move to Dr. Ziyed once again. And I guess Simon brings up a good point in saying that everyone is things are moving very fast, although we don't want people, of course, flooding the 811 number, but at the same time, or going to hospitals if they think they may be infected, obviously. So we want them to act appropriately. But I guess at the same time, with the similar symptoms to the flu, and also cases increasing, people are, of course, they have questions, and also we have 2 cases, I believe, that they believe may not be linked to international travel. So maybe you can give me currently what the province is recommending people do, I guess, if they do find themselves in this situation, as we discussed before, that they think they may, that they're feeling sick or whatever, and think they may have the virus. What's the protocol they should follow?
So for the guidance in this case, we have the self-assessment tool that has been online. So any person who has some concern and he's not really knowing what to do, we advise them not to. If they are having a severe symptoms, they have to go to the hospital or call 911 or emergency. But if they are having like flu symptoms and they are really confused what to do about that, they can use the self-assessment tool, and actually this tool is very good. I heard from communication that it has been used like 86,000 times, so that's really great. It gives a good guidance what to do according to this algorithm. And if they need to call 811, they call this number. And before, we heard the last few weeks that there was call waiting, but now they increase the capacity, they increase the lines, they added new features like call waiting, the call waiting, and so that they will be like called back. So this now I don't think there is any complaints with 811 line. And then 811 line will do a very good assessment. They are registered nurses who are on the call. They can give guidance to the caller to exactly what to do. According to this assessment, they are guided to either to go to the site for the testing sites, or they can just self-isolate or call their physician, depending on the assessment. So that is a good way to guide people and decrease their anxiety, and in the same time doesn't increase the load on the health system unnecessarily.
Okay, thank you. Did you want to add anything to that, Josephine?
I do want to add something. We have set up a health line for general or health-related questions to assist band members, community members, with public health nurse on the other end of the line. They're not there to diagnose anything. They're there to reassure community members, to be able to answer some questions that you may, maybe in a first call before calling 811, if their symptoms are very minor, or if they are just concerned about somebody else, or and the other thing is the accessibility to the Saskatchewan.ca has the self-assessment, but not all of our community members have access to the internet. Not all of them have computers, and in this case, that public health nurse can be contacted, and she can go through the online assessment with them. And then, then they phone 811 and say, I've gone through the online assessment, and these were the results. And then carry forward from there with the recommendations.
Okay, thanks very much. And Dr. Ziyed or Josephine, whoever can answer it, I might ask one quick question before translation, and that's, we know that there's testing facilities in Regina, Saskatoon, obviously, Prince Albert, but is there any plan to maybe roll them out to some of the more remote northern communities where people may not be able to get even to Prince Albert or get testing?
Yeah, there is now test in the north, in the northwest, in areas in Buffalo Narrows, in Isla Crosse, in La Loche, and in Beauval, and in the northeast there is in La Ronge, and in other communities like some other communities like Sandy Bay or Creighton. We are establishing a way so that if there is a call from the 811 and the person needs to be tested, either there is home testing or we arrange a site close to the clinic So also we don't overcrowd the clinic there, but we have some arrangement in these areas for testing. The same is also for Athabasca.
Okay, thanks very much for that. So I guess we'll move to Willy for translation, please.
Merci, Fraser. Kukani Horal Kursan. Tandanagalan Hadra Luli Nunda. Reem Ziyed Horal Kursan. Fraser Urin Kursan. The Hatlanta Ayani the Nutho, Boring the Ruto, Flulanti Contibits in the then Laraniha, Tlantu. Then Cyrilia Leo, then Larani Contibits in any than Daniel. Well, Ayanelini than there, Joanzi Ayanelini than there, Netina the low, Neji Trail, Neji the Duelanto, continents in there, maybe 911s and phone loot ho, the hospital nearing tea had there, Nabaho and the hospital nearing tea Henisa. They're dying low. Number the debits, you already 811 and in a sunny. A registered nurse, a phone read ASA, the phone that there, a adult AC, a balcony there, a nurse that's any has a Henderson. Could the testing sites, couldn't either there, not the neural key, and couldn't either the doctor the cold key any some. Could the Josephine Greyeyes I do. The health line debits is their members Black Ronge and band public health nurse the only 811s and the phone only. Could the testing sites Henny there's a 10 minutes and Saskatoon, Regina, Beauval is the P8 the testing sites only Lagozin. Could the Ziyed 10 minutes and continue Lusa Henny Cochoitzano, Isla Crossu, Nintelas 2, Ayer Dayino Jalaranju, Sandy Bay, Creighton, the testing sites only had those there, Henisa. Aradisa, Salodina.
Thanks very much, Willy. We're going to move very quickly to a commercial break, and we'll be back in a few minutes. The question was Josephine and Dr. Ziyed answering some of what's going on in terms of if people do think they are coming down with coronavirus. And testing and whatnot, and we'll move over to Abel to provide that answer.
Well, tutti magayakawayak maskikit no takavitap ma ikaguitsemihta ja kispinawyak mamtunidihtammi hikuma kispinantavitta matsiho. Ja kohanohtikiskidihtamaa kikoksuino magayana ja tuituma ja kispinawyak ittukimanamaa ja maagana ja takahkuitse magigoi kun sisäputtakin takahkuitse magigoi kohtanas kuin osihtaa voi kun taivattakin yhtämähtä nämä kiikahsuin nämä kämiskuidihtä mä kohta täytämin aujakin mistä hissa ja auja kohta ja poiskatte mä tiedä ja auja kahkusiga muu mä nämä teki tohti taujak i tyttö mä puminanta teki sai muu auja 811 ja kun tehtukin meidänkin kohtakin yhtämuu au Magi tuittom to nimi chit ja pachita chaga nimi doanta ja 86,000 niituita ja to nimi chit kotti tugi sai me chagoma it's tan tawa pina sotta so chawi kispinchi ki wa husuino maga ya toma wamina ya Josephine mi ni tuitoma ya ko tatla Ronge band with the maga ya I ayakana ma ya ippi hottom pa am kappi maski hisku ayaka Tittagia ja mihit. Ja so a health line uutta Ronge band ja kappi ikutamaski hiisku joko mintagia ja miha on nämä ja kun se meni aitu itse kun mutta puittu komettagia ja kakuitsemihtsäkä punniihta puittu kun kuttia ja huita muilta kahkita ja minun mäkä tässä mutta ja kun niin mäkä tanssittakin ja aujatsittakin ja mihin joka ja kun mittukin minä puhuttakin, että sekä tioti, että niinkään tekä kui ihtakotse koko, apui uitsiivaa niin mutta pui niihin tuitsek, niin tiitittää ja noittakin kahkuitse mihtsäkin kun kiispinä uijak, vaan niitä ihtämä puhumaamtu niitä ihtämihin kiikoi. So joku smägoit niitä, Willy, or is it Fraser?
Fraser.
Okay. Thanks very much, Abel. And just want to take a brief minute just to mention that, of course, we do here at MBC serve a very large area, as we know, and very diverse Cree and Dene and First Nations, Métis, and a lot of people. So we understand we have two officials here from Ronge Band, and then of course an official that works out of Ronge. We do reach out to the Prince Albert Grand Council and also to the Northern Intertribal Health Authority. Everyone is very busy right now. We put it together fairly quickly. So we apologize for not maybe having as broad a scope as we might have liked, but to keep in mind that many of the answers that our officials here are giving do apply to some of the other communities, of course. And we're certainly open to, depending on what our listeners think, we can always do a show that is more maybe Peter Ballantyne Cree Nation focused or Athabasca or whatnot. So we're certainly open to doing. We just don't know what's going to happen with, but I guess we're thinking this may be going. The situation it'll be more than a week, I think, anyway. So. With that said, I guess I wanted to move to Dr. Ziyed, sorry again, because I know she has to leave probably in a few minutes here, and ask you very quickly, I guess, and maybe you can't answer these questions, but I'll try anyway, it seems the numbers of increase that we've seen in other countries, Italy, China, some of the various places that United States now and even in Canada a bit, that the numbers increase fairly rapidly with COVID-19. So do we understand why this is yet, or does anyone know? And I guess this is the real difficult question with some of the measures that Canada has taken now in Saskatchewan. How long may it be before we'll have a handle on the numbers and maybe things return to normal? If you can give us any ideas on that.
So that's a difficult question, but I like to say that in certain countries, we have seen these escalating numbers. Things were not taken for certain in the beginning. Social distancing was not practiced in the appropriate way. The other thing, there are many factors. There are many elderlies in these communities. There are no strict measures have not been taken regarding, for example, long-term care, being away from visiting adult seniors. So things escalated in that particular way, and once there is a community spread, it is very difficult, and then it was the social distancing was not still not going as strict as possible. I think Canada is doing a great job, and I think we are in Saskatchewan. We are doing a very good job right now in trying to contain the infection, and containing mean detecting cases and early isolation, and the responsibility about the people really trying to get into the self-isolation when they are sick, wash hands, clean surfaces, and we try to reach out for most of all of our stakeholders, and for people through consistent messages about this, because it is very important to take it really serious. And the more the infection is contained within, like it was first travel related, but the more it is contained in terms of detecting cases and isolation, the more we get less of the consequences of spread. And so again, back to your question about how long. So it depends on, of course, our community efforts and working through our weaknesses. So trying to really mitigate or contain the weaknesses as much as we can, and be very taking this simple regulation as serious as possible, and also. Of course, hoping that when the weather is better or warmer, the virus also can subside. But for now, it depends on our efforts. For the duration depends on how serious we are taking these rules. And I can't emphasize more about social distancing message. It's very important to really take it serious.
Okay, thanks very much. And Do you have time for one more quick question before you go? Okay.
I actually messaged them. I'll read it a little bit later.
And I'm not trying to put you on the spot or get too technical or scientific, but
No.
we live in a world, in the West, I guess we take for granted of health, right? That we have fairly good, hygiene, and and I think a lot of people, myself included, thought, well, we have measures in place that we can handle. I was hearing on the radio today, that it's probably the plague in 1918 was the last time that Canada saw something like this, and so, but it's lots changed. So do we have any idea why this particular virus maybe is a little bit different from some of the other pandemics, outbreaks, that and the way it's spread? Do we know why this is? Maybe perhaps that it's really affecting the whole world now.
So coronavirus, and when corona means like this spikes around the crown. So coronavirus are viruses that has before some respiratory infection, and it affected the world before. It is the same family of the group of SARS, which affected the China before in 2003, and also we were affected here in Canada. In 2015 also it affected South Korea, another type. So this family of coronaviruses live in around animals, birds. So when it is transferred to human, when it comes like this animal-human interface, so it transformed and it become kind of little bit changed. That's why we call it novel coronavirus. So when it's affected China, it was with the overpopulation and overcrowding, and now we have more mobility of people going everywhere. So things transmitted or spread rapidly with the international travel. But this type of virus can cause usually from mild infection to severe epidemic. So it is known to have this cause of epidemic and severe infection as well. But I don't want really to make the picture gloomy. I want to tell people again, it is a flu. Most of the cases that we have, they home recover and they are not hospitalized unless the person. The high risk here is the elderly over 65 or people who have other illnesses. But in general situation, if a person is affected and they are home isolated, they recover. They have a smooth recovery.
Thanks very much. And that's a good point that you bring up, is the mobility. I think our world, it is much more global than it was.
It's much more global than before.
Right, and I mean, people are, as they're seeing, some of the cases. I mean, they were in several countries, just to track. So it's but that's the reality of the world we live in. I guess we'll have to deal with that accordingly. So I guess we'll move to Abel, I guess, for translation on the.
No, Dr. Ziyed, I didn't get anything you said. Could you say it over again?
No. I'm just functioning on pandemic mode now.
Anyway, iga witsimito maski no, tanspinanto. Ittiidihtsiga tagiat niigippadagoma, tagiat ponaasuuskamaattu nanuga potaniigippadagittu modaya mudumtulekitsinahu nano modayagi tanspi magaya taapaganse attigi supuigo mahpua puittugimintaat niigippadoma aga modakitsinahu niaganema igahaya tanlugohminaga sohkaipagamiskagua well iaganema tan sumi tuttamaga nohtsumaga gissigag tan sumisin tohtamagomagi tagi suaskawia komagi tagawia kin tohtinansi taas kutsiagoma ja igatamah mihchitia kin tohtinansi iaganema so tansiga tuttamaga nohtsaga gissigag iaganema kawapahtina notiat nigan kispen kitayagomsinano kisin ko iskip mitsahinano tansigissikamigawia la puittugivanema kuipasnaosta midayano I tuittawa kohaya manemaga ja kumaksuina nemaga tugui ja inum tansi uspanekitta kohpuau ja kiminawiaga ja ahkosso no ta kohchidi tawa ja komaka uitsi ko tawa ja disi ko kumaksuina mutta kohaya kigiska gogmina ja piskisi saga pomena pedisi sagi tuita puittugi jasko ja et setnumana kohtu asoskamatoma Joka minun mä nostaa kissega goma ja taas kutsa wathouti uttaskana kagi missä kosenano ikittu itsekemä 1918 vähän nanto. Ki missä kosenano mititkin puogatset nuok. Maagi kohoma ja annotset tohoma kaya komin 2020. Ida ko iskip muutti huok muudi so ohtispat 1918 maagi kohoma ja kille paha ja kip muutti huok wathagagi totti hunnano ahta iskamaga kamaski na pihana kaskapahti medagana mistä hip muutti hunnano ja vanha mistä ga nigi negatti ko kisingi pihtina wao nigi negatti kip medagana miorse que pahe gatti ki oi gata sapuhti tauja kutta ko haskia so igual no que pihtina noma inottaka kui niige pada ko mutte he gata kui asuskamato nanoik so ja muuta kihtsena hotan spitagi niige pada maga ja kisin sokatus käyttämähki tohtamahki tän somatti tisoaskauja ja kannamakin kavitsi kun nämä ja kavitsi juoma social isolation ja hiikättämä mihtsitti ja kuitenkin saa soipata kun muuta nämä so joku se pitämä.
Thanks very much.
Okay, merci. Ku kani Fraser yung kursa Ziyed dani gantant andadre dadda tali fadaza nal only saniden yelni sandre dadda ku nasket naneten China teno United States based choneno the Italy danli goziten der dadda ka ananal tlajala numbers ke nara dajao yadan fadaza bel only saniden well dinadu der ku that dana o that tibuni there that dana as night day in de kara jolin sa henni sa kuluza kono derila der virus buni there that dana as night do kodrillian in de kara one yan sa henni sa good and then a long term care then a bodilna after the bodilna the rules do azi not serila ani the bodihasa could the Hansan Yare Gozi Banu Sahuni than Sonla the rules not clear in the Adu Anzi Henny a social distance in a cono learning there that he dana do Kara Uhanini a follow rules Henny Nalagan old Silu that Tlahel a Yerdain lo then I got an old Dezana do Kothoril in then aid of Kodu Yerdain lo then a chazit in as a deasa then it elot honilisa could the our creditlant other virus it dunalant ea nahi tadaslin ha anisa could 1918 er ku the azasi soundly lo dun 2020 la dan het dilosi health officials that do der dadda kara aneha rules that there was others and there are DC and then a health budget nada there are DC gar rules that there was other there's only Henisa Ziyed do.
Okay, thanks very much, Willy. So may I move to something we were just discussing very quickly at the break, and Josephine brought it up. And sometimes we forget, or I guess I forget, that some of our communities, the communities we serve, the first language is not English, and it's maybe it's only Cree or Dene or another traditional language. So what I know that Josephine, you said this is being talked about so that people can get access to the services in the language that they feel comfortable with or will understand. Maybe you just want to give us maybe an update about some of the meetings you've had or where things are at with that.
I just actually, after our conversation, made a note to take back to our emergency control group and to the meetings with the province that to have a recommendation that the 811 line have translation services available. Also, there was a question if our local phone number at Jeannie Bird Clinic, the 425-1720 number, if they would have somebody available to do the self-assessment in Cree. And Simon has assured us that within his pool of volunteers, he has people who would be willing to assist clients or assist the membership with self-assessment over the phone in Cree. Dene, we do not have that service available as of yet. There was discussion on the break, so those are definitely things we'll be looking into. Language, the comfort of people is our biggest priority right now, and really meeting the needs of the communities, and using people's first language is the most comfortable for them. And I think if at all possible, we should be providing that service.
Right. Thanks very much. And I wouldn't be surprised if even in some of the Dene and Michif communities that there are probably people moving on this ground. But as we all know, things happening very quick, and we have a very large area here in Northern Saskatchewan. I guess I'll move to Abel to translate that, please.
Well, tutti me kusavi Josephine tuit mintä sotsaassa kiitty ja numaa ja kun nikuga ja kiiga kada simutsik miniga iga kans tohta kada simuin ja kun nikmäkin otti kuitsikin mutta oikein kai kun kusavi tuita ja Josephine negatos katina nega viisatos kimanan sai mun minne mä nega mä mopiak negatos katina nega miskawana naujakin ne hiduit ja Tajamiha tauja hänihi, ikä kans tohtamit agadaasimuin, ikä kajamit agadaasimuin. Nikä miskawana naujak. Kun tähtettä tajamiha tätset no hiituita. Uutiminäkin tohtaa nanomaa ja kiisikä kuitsemme kauja. Uutinakin tohtaa nan kiisminuita määkoapo Saskatchewan Health Authority ja gatsimiinen niitä. Ja kun nimenenkä pihtakotta muana kun muuta huista aikottiittakin ja jaatse kauja. Inni hiduit mä nämäkä ja kun tiinuhtiissa emme sähpuojakin 811 että tajamiha tauja tän stohtavaa tän stohtaakot. So jokainen mä mini mä tuskaatama muuta siis kun tähän tänään mäkä pihtiinään ja jokainen mä jakin tavii tehtää kun kiityttävä Josephine.
Okay, we'll move quickly over to Willy, and then with keeping in mind that we're just coming up on a break here, but I think we got a few minutes.
Okay, kani dananga hodiade during the break jan banda yel khiniasa dung harlyun den tot inadait andilon la ya guzin ni thatsen 811 sen phone alyade den sun khine that dausan year and not den that dausan year da hansan tha be ya thi ayal thi horel inde harlyun den tot inadai ande althino na hid den sun khine den dai ande althon la tot inar ni andilon la guzin ya ni thatsen da hansan tha phone alade den do di land u an den ayalthi tot inegolin si land u den halyalthi anisa so den ya Josephine do korisi hani da hansan tha phone alade guzin نادي ثداو إيراين لود الخان خدنا أيالتي دي ثداهاني جادي كنت إهاني ناتوز هاقوش شيني كلو جيني بيرد كلينيك 425-1720 and phone الخادة نازا ثداها خلونت كلو دنازا خلون دي وندي يا Saskatchewan Health Authority دي كنت إني نيثا دي كنت ديدا يرد دهان phone الياده نياتيا ينالكيويل إنده يرد دنا وتينا نرني هذا راديسا.
Okay, thanks very much, and we'll break now for news and commercial. Okay, we're back with our COVID-19 roundtable on MBC Radio in Ronge. I'm here with Simon Bird of LLRIB Indian Band, as well as Josephine Greyeyes, LLRIB Indian Band, and we also have Dr. Ziyed. And just very quickly, as we speak, there's an update, I understand, happening with the province on the COVID-19 situation. So keep in mind for that. We will have some updates probably later in our news for you on that. We were talking again about before the break, Josephine, on food security and not just food, but other durables like medications, things that people need. We know that Northern Saskatchewan residents have some challenges with that, of getting access to food and also costs and things. So how, from what you're hearing sort of on the ground, are people able to get what they're needing, especially when we know that some people are buying more than they usually do and things like that. So maybe you can give us an update on that.
Sure. Thank you, Fraser. We currently, We at Ronge Band and Keythenau group of businesses are fully stocked. We have trucks coming in still on schedule 3 times a week. Today we realize that today is the biggest purchasing power for those families who buy a majority of their monthly supplies on the 20th of the month, which is child tax. So we do realize that today our stores, could potentially have sold a great deal of their products, but for community members to be assured that trucks are still coming in 3 times a week. There is no food shortage in Ronge. We're not without food. We're encouraging families to continue to provide for your family as you were prior to the pandemic. Just again, personal responsibility and taking care of your families. The food supplies, like I said, are still coming in. Same with the Ronge Co-op. We're good for food supply. Those remain intact, those supply trains. Plans are in place for accessing products for distribution and primarily focusing on the elderly, sanitation supplies at the moment. We have, like Simon said, there's been companies offering to help. I know the group, the Men of the North, and have Christopher Marasti has contacted some of the mines, various mines, the different companies within our region, and they've been in contact to provide some assistance, whether that be monetary or donation of food supplies. So we are going to work with them. There are no details at the moment, but we are working with them to see what options they have available for assistance for Ronge and community. Any companies that wish to donate, wish to contact us, they can contact me at the Jeannie Bird Clinic. My direct line being 425-1744. So anything, arrangements can be made on behalf of Lac La Ronge Indian Band. I had a couple, I was going to say that Keythenau Supermarket is actually taking orders by phone and providing delivery. They're actually encouraging community members to do that. So they have delivery drivers. They're trying to, again, practice social distancing and just allow people to stay in their homes and be able to call in, place their order. They, are delivering. So that's really commendable for Keythenau Grocery to be, that vested and providing that option, that alternative to going into the stores when they're crowded, when they're busy. They're really trying to limit the capacity in their stores. One update I had that Bell's Point store will be closed. Keythenau Supermarket, Keythenau Gas Bar, and Sucker River Community Store are continuing operations, and just the lumber store is closed. So other than that, I think that takes care of those questions for now. And when we have more answers about distribution to band members, keeping in mind that elders are our priority, and those in the marginalized and vulnerable sectors will also be looked at as the next in line for assistance if any becomes available.
Right, thanks very much for that. And I thought I might quickly note as well that I know in the city of Prince Albert, the Prince Albert Grand Council has been coordinating for its urban members, which of course is lots of people, the Ronge Band members of Peter Ballantyne. Basically the same thing, getting food and durables out to maybe people that can't get out to the grocery store, things like that. And we ran a story also on the Fond du Lac Denisovan First Nation that is running its own I'm not sure how exactly it works because I didn't do the story, but they are doing a caribou hunt to make sure they have a food security supply, and also they're doing a special distribution to members to make sure that they have enough money to purchase the durables that they need because it is it's an emergency situation. So with that, I guess I will move over to Willy for translation, please.
Kugani dalingande athiade Fraser Kirsan dadu buru night dio dlant e Kunti Tlano Hetsunsa, Henisa, Ku Josephine do Henisa. Harlun stores no hets a sea lambe no hets is a ene. do what deal and needless in him. Trucks not kid only Shatterat ha. Ko don't Zenega to quit some bagadrill yala. Ana here the grocery salon see doing action and don't do it Hosahani, but Kulu stock yanali on the Sahani. At trucks did not Shatanat equalance. The Shaquin of Tere here, the rose new. Your dying low, Jalarange co op the Dari Tinti low, the Aslon groceries they only say. Hennisa. Could the mind down leads on the Belde LTO and Sarot near Rose in it some bazut ho, burb bazut ho, aid in the Zonli Hennisa. Go Aslon the Hankuni than that, then it sits in in there, sits on phone saying la 425-1744. Could they do the Keaton store like Ronge Indian bandwidths doing orders that seems that because if one on a lot of their house is a hilly there, there na Banili has gozim. Bell's points on Badaran town, the lumber store, the Badaran town, Hennisa. I can't do a dalanasa, John Dizzy.
Well, Doti Magaga, Ikawichimita with Josephine, meet you in Noche. Kun he kutsui Josephine, ikä tästä toi joku muu lämmätät no tipetuin suin. No ja kiävätsen mä kutsun koko avata saganak. Muuta näntöissä ja niigi joku muutakin pihtsi joku kiävätsen mä pitää noota mitsuin että aikameko piitohtanut ikäinen mitsuin että aikameko se otti tihtakon mitsuin ja stopi ja kespeto pitää kutsun posihtaa saganak pitää se mitsuin niin tuittava. Minä ja kikittää vähtämään hiituittuumaan ja puittu kummakin tiedäminen, että näkyttää maagikaa näin tekivan nohtiipä tehikottaa, teki tohta mua nekin. Ja minä ja kuttaa ja kiitän on supermarket on muuten niihin tavatta eikä me koomaan ja band offs niitä ja tsemmättik chiigi. Ja kun ne kuitenkin suoskaa chiigi, itse pokaan ja teki musta sen totsekin, kun tahostakin musta tajamitta on jakapuu, tämän totsekin. Ja kahti tohta mua. Eli mitä on totta kyllä ti tohta mua. Muuta kattaa suitti pitää ti tohti tän tot. Negi teki ot negistä mua aina. Kahta kokota ottaa tasua teki ei tohta mua se kauia ja ot negi win tuokispin aja mettavi. Ja kannemä ja piek minäkin kannemä miskotsa muuta miskottu padoakata eikä me kohka ja Viitika tästä tohti taujaksi joku tämä minun ja kita no supermarketin totta kaikki no joku musta totsakin jotakin tohta mua ja kuut nikyinä ja kamina ja kauJak minun ihtä kun tää ja mihän tuo hottia ja mun ja sonia on nohakappen pätihtä koko mun he sonia oikein mä koko kiit nohotti kap mä kämmekästi ja mihinkä mä näin teki switchi hyvitse ka puittukin sonia sa agatsi kun teki pakit nasotsekta vitsi hatsekset no musta pinittää kamera nooma joka puhuu ja minä kispinohti pakit nää suomenohti vitsi hiu ja PM kiitytä ovat Josephine 425-1744 ja kun tää soinohti Ginebra Clinic kiitytä on maskikin ja menti takana maskikin ja hoitaa kamera ja kun niminti takana kada aujakti tästä sota nohti jotakin maskikin takana on heitä pitää noin näin ja kun so joku saa ei tätsä mutta Josephine.
Okay, thanks very much, Abel. So we're moving along here. Unfortunately, it's a topic we could probably spend the whole day talking about, but people do have schedules and whatnot. I really appreciate everyone for taking the time to come out and discuss this very important issue with us, the COVID-19. So I will offer it now. I've asked enough questions, I think, so I'll offer the floor to our guests here for some closing remarks, and I guess we will start with Simon, please.
Can I ask a bit in Fraser? Just a little message out for Oskip Matsak, Oskayak, our young people, and our students and our children. What you want to do is make sure that you ask questions, all right? It's okay to feel anxiety. It's okay to ask questions. It's okay. What you want to do is the more you ask, the more you learn. So make sure that you connect, even if you can maybe ask mom, dad, kokom, mushum to touch base with through Facebook or text. Anybody. It's important to that we all do this together, young and old. That to support, we always wash our hands. It's just very important for our students and our kids to limit visitors so we can make sure that we protect all our elders. With that said, in terms of myself being a volunteer coordinator, if you are interested, you can phone me directly for Lac La Ronge Indian Band communities here for Hall Lake, Suck River, and La Ronge. And also, I can pass along some information to our communities of Grandmother's Bay and Stanley Mission at 306-380-8392. 306-380-8392 for volunteer coordination for Lac La Ronge Indian Band. Dene.
Thanks very much. Did you want me to move directly to translation, or should I just go to... Okay. So I guess we'll move to next to Dr. Ziyed.
So I just want to tell like final words again for all the people who are listening with us. The key message is again, please take the social distancing seriously. Wash hands, clean surfaces, and if you have any doubt, just do the self-assessment online. Or if there is no access to online, you can call 811 and they will guide you. Trust that the health system here is integrated in the north. We are trying our best to contain the infection, and we're trying to be as collaborative and as transparent as possible. Cases are reported when they are presumptive before even confirmed. All the information online are up to date and transparent. If you have any question, please share your questions through the Saskatchewan Health Authority website. So there is some query that can be sent there, and if you or you can send it to 811. But again, I just want to emphasize this, that our collaboration and personal responsibility is very important in fighting this infection and this crisis that we are going through it, and we are going to pass this crisis, and things will be fine by our collaborative effort for sure. Thank you.
Okay, thank you very much. I guess we'll move to Josephine now.
So in closing, I just want to take this opportunity to thank our hosts and our collaborators here and our translators. We are trying our very best. Everybody's doing their very best to do their best job that they can. We are working as teams in concert with all the different departments, federally, provincially, NEATH, the Saskatchewan Health Authority. Like, there's just so many partnerships and so many facets to this emergency. And I just want to assure people that if we're doing our part, if we are practicing social distancing, we're practicing infection control procedures by washing our hands. It is our own personal responsibility, and I hear and see many people saying, I would live through it, or I would be fine, I'm young, I'm healthy, but you're also risking transmitting to the vulnerable in our communities, and I want you to take it very seriously. The social distancing and the parameters, the guidelines are in place for a reason, because that's the only way we're going to flatten the curve and be able to contain this virus, is for everybody to individually do their part. So personal responsibility, taking care of your families, taking care of your environments, and just exercising those infection control practices. There are many mental health services available. I know it's a very stressful time for everybody, and to make sure and take those media breaks, take those social media breaks, and not get outside, enjoy some sunshine and some time with your families.
Okay, thanks very much, Josephine. I guess we'll move to Abel now for translation.
Well, Dene ayak Fraser ayak omisitu ayak omiskikitno ayak nui chatuski mana na kuttaga kittu ayak imammo atuskanu ikom muuta pähpiskis pähpiä katuski joka tsetnog maga tajami hitunan ika imammo atuskiak piegi kwakihchi kihtsepakutetaaja katuskaattamak iagomaaja igatamah mihtsiittiak. Iganem piirane mantagamina atsemuin oma kihtakohkoma atsemuin. Ikuttahan mästi, tegi vapahtama uiga muuta koi käätano, muutakin koki muuttaa kamikan. Kihänä vannema. So kisminäkin tämänkin kohta kuitsikin muin tännekin kaka kuitsimatsiga ja Saskatchewan Health Authority. Niin tiisaimme. Ja igomina ja saimun minä kai ja mittumaa ja inohtee mihän tuo muskaa ja avassa huokuukaa ja miksikin itse kohta. Muuta nämä näitä kuitsikin muin kiikoi. Kisinkin vuoni tihtiin kiikoi, kisin muuta kiikoi kiiksena on muut nänto. Kuitsikin muin, kuitsikin muu. Kuitsimekin niinkin hikok. Kuitsikin mun suom kohkom. Katsi ikuttaa katsit no kuitsimik. Kisin muuta kiikoi kiiksena on. Muuta nämä nänto ja kanema. Ja igomina ja iga tämä mihtsit tiekoma teki juokattua. No iga mihtsit että uisaa maahan että piitä että missä mä muijattia. Kiämä ja pitää omaa ja iga tämä mihtsit tiek. Igomina ei tuitoma ja kispinoi näntä nohti suitsi huiso. Ja komitan takihtaa sontui 306-380-8372. 380-8372.
8392. 380-8392.
Oh, 92. 9 sanoo, mutta ei 7 maaga ja kiigamtaa hän missä ostaakin nähmään. So, joku sitten Simon, ja Josephine minä ja missä ja imämo pessoa huoma. We work as teams. Ja imämo toskia kiituittava. Taas kutsa ja Nui chatuski mananak the federal government puhutti ogimauina Ottawa kakstavida puittoki soniawi mauk the provincial government yegonik min taymi hananak nui chatuski mananak nitha yegonik min nui chatuski mananak ikagui mau toski yakoma Saskatchewan Health Authority yegonik min nui chatuski mananak tämä mau toski tayami hittoa atsemuin mahte piakonomi tatsemuak piakonkin kai täytyy tehtävä homma, uskatsomuin täpito ja tehtävä mutta and we have to do our party tuitoma. Kiitän muutakin mä sanan me saa around band että täytyy mumito. Kaikki on missä piaku ahpo kun täytyy skaattama mutta täytyy skaattama kun se piaku ahpo mä kaikki ja minä ja ihtakon muitsi hiuin. Kispinauja näihtää vidihtäm, kispinauja siiki soahpuu. Ihtakon on muitsi hiuin, ja ihtakon on muitsi hiuina. Teki miska maujak. Itä tohtsu itse hit. Joka meidän media breaks, ja tehtauja kapiiki tapahtama, ja puittoki itse kanssa vidihtäkään television, puittoki kapiiki tapahtama, mutta ja muins kapia ja mihtsakit. Pittämää, ja tuipihtää ja kannema. Pittämää odawi. Siis auhti, tai kasvui pitsäkin. Kaya dagapi kita bahta adaman tahat semuina wawis cuma semuina makato cakap tiga dagapi midasin tak sekali tak kau yak tapi tak tan sita kami kan tak magi tak tamin nak kapigi sekau yak kapi tapi takin apa tak kau tanya mereka dah pu semuin muda benosami yak ada midas sekali yak pu itu ki askot taki wadau yak kiam pu itu ki taki si sauti yak kun si segi kahput näitä tapi yak ten tega subi segi yak kahput että niin poko kino wadau itu mutta näin taas kau yak tämä luipihtaa tu caya magan sauyak tämä luipihtaa tauyak semuina homma ja ka tu cegatikin somikin skina aci itu itse kokottaa ja kuuttakaa pian semutsi kohan ja atomikin kun ei mihän huomina ja Prince Albert Grand Council tauyak teki pitohti kun tiohtsi mistä homit sanavit mä kauyak mistä hitsa nauitsakat sitten kun itse hiuja kun niin käänniok se on muutoksesta ei pätehikittu kaujak ja niitä päähminäkin kun itse maa muonnakin piuita minään ja kun minä kun itse naujak mä kahpuittu ikin tomu musenga totinan piitos saujakat tai mihän ko se joku sama thank you
Merci Abel ku dan hallien kidun zinige Josephine Greyeyes irdain ludi Reem Ziyed and of course, Simon Bird, the Mercy man, sent unzenige General Health Tia, Yazikora Dila, Dundan de Tia, Exalara Dila, Sagazinara Dila, Nuniti, Asorai Jadas, Asorai Didas on some, Nuhladi Canrail, Siluda Tlahel, You're dying, then a chas in I do. Then a chas it in not a day. This is one sam. You're dying low. The dan a yabagan of Trasi. I eat Besut Nicolo by Kubagano Tilsana. Nekono te, a sea kilson, a sea central Tilsana, than a lot of old Honilo. Colosans a quay, a catla is not dead, he had done la. The habit as Herelia there, bit as not dead, he hasn't eaten. Then not he begat Donald Snacher, but Donald Halle, the series. A Harel Salar Disa. A dear that's already there's one ila a ad and rules and would see and that how deal was see. A coro name le Canida is sing as a Rotenza, no Halkur see mercy.
Thanks very much, Willie. And I guess I'll give my closing remarks here, and I'll give the language announcers a... You're good? Okay. I'm going to go ahead and give my closing remarks. Yeah, we will be done with the show. So I really want to thank our guests for joining us today. Again, we had the Lac La Ronge Indian Band Education Director, Simon Bird, La Ronge Band Director of Emergency Services, Josephine Greyeyes, and Dr. Riem Ziyed, who is the Medical Health Officer for the Saskatchewan Health Authority's Northern Population Health Unit. And I wanted to thank very much Abel Charles and Willy Billette for providing us translation in our Cree and Dene languages. And also want to thank Riley Novkoski and Dave Ellis for providing technical support, and Brandon White for video and camera. And lastly, I want to thank MBC Radio CEO Deb Charles for giving us the opportunity to, or making the suggestion, I guess, to do this program, or coming up with the idea, and then giving us the opportunity to put it together. This is Fraser Needham with MBC Radio News in La Ronge, wishing everyone a safe, healthy, and happy weekend. Thank you.
There is a better way to buy a new or new-to-you vehicle.
Thanks very much for coming out. That's lots of information there. So, see how things unfold.